and welcome to another Kinstretch class with the Fitness Alchemists. Today we are going to be working on elbow rotation, kind of finicky, but can make a huge impact if you are suffering from any elbow issues, pain, dysfunction, whatever. And it also can inform kind of what's going on at your wrist, so also helpful for wrist. And then we're going to superset that with a corner of your hip motion that can go unexamined pretty easily. It was new for both Hannah and I when we figured this one out, and it makes a big difference. So we'll get some of that in at the end. In terms of propping today, you're going to want to go find a trusty soup spoon or implement from your kitchen that has a nice grip on it, and kind of the heavier the better. So I have a wooden spoon here, but even better would be like a big cast iron spoon or something. We're going to be using a short dowel, which if you have something like that, that could work as well. Again, having a little weight to it really does help, but the main thing is that you need to feel strong gripping it when we get there, okay? So if you need to, pause the video, go grab that, and then come on back. And we are going to get started in a comfortable seated position, whatever that looks like for you. And then go ahead and hold on to your soup spoon right on the end. And make a 90-degree angle at your elbow on that side, and bring that elbow right into the side of your body, and really try to actively pull it into your rib cage. So like you have an important piece of paper between your upper arm and your ribs, and you're going to try to keep it there the whole time. And then from here, nice tight squeeze on the handle should help light up tension in the muscles all up and down the arm. We're going to use that to feel what's going on as we begin rotating at the elbow joint. So if the elbow rotates, you will see the end of the spoon rotate around your wrist, basically, with limited amount of motion of your upper arm turning out. And that's not always obvious, so I want you to just start here with this warm-up, just trying to zoom in and feel, oh yeah, my elbow actually has some rotation to it. One thing you can take note of is that, you might know this, your forearm is made up of two bones that essentially cross over each other when your palm turns towards the floor. And then when your palm turns towards the ceiling, those bones are parallel to each other. So sometimes that can help visualize what's going on and what you're feeling in terms of tightness and tension there. Go ahead, get a couple more, squeezing that fist nice and tight. Almost trying to tire out the arm just a little bit as we warm things up. Good, and relax that. Grab on with the other hand. Same setup, so the elbow pulls into the body. Squeeze the handle until you feel the muscles of the arm assert themselves, and then keep that work going to help feed back the maximum amount of information from that tissue as you explore rotation. Now, like I said, it's a little finicky, so I want to introduce some positional terms that I'll be using. I threw them out a second ago, but when your palm turns towards the floor, we're going to call that pronation, or pronating your forearm or your elbow. And when your palm goes towards the ceiling, we're going to call that supination, or supinating your elbow joint or your forearm. So as you go back and forth, I think it can be helpful to just tag those positions in your brain by saying them inside. Don't worry, there won't be a quiz, but it might help you navigate a little bit more clearly as we get into the isometrics. Good. Okay, last few, really gripping the handle, trying to melt that grip in your hand. So you're trying to squish the handle. Good, and relax. Nice, okay, go back to the first side, and like I said, we're going to explore a little wrist here as well. So same setup with your elbow into your body, nice and tight, and then gripping that soup spoon handle really nice and tight. Imagine that it all of a sudden became a hammer, and you're going to do some hammering, but without letting your forearm move at all. So you can come on over with the other hand and grip that forearm if it helps, and then using just your wrist joint, hammer down, any accent you'd like, hammer down, and then pull it all the way back. And as we go back and forth here, you might notice that the motion is a medial lateral motion of your wrist. And if you caught in a Kinstretch video, I think a month or so ago, we did some wrist capsule stretching, and we were zooming in on that capacity, that medial lateral motion of your wrist. So we're just touching base on that now. Last few, really squeezing the handle to make sure that the motion you're getting is 100% active and you are not getting pulled around at all. Good. And let's go to the other side. Same setup, make sure that shoulder is stable, the elbow is pulled in tight, nothing's going to move except for that wrist joint. And especially when you pull the hammer or the soup spoon back towards your shoulder, our wrists are very, very stiff in that capacity. So make sure you do come to a complete stop and visit as much of that tissue as you can. You usually have a little bit more excursion through the other direction of going into the hammer down position. Good. As you finish up here, really squeezing the handle, I'll just mention this is a great way to keep nutrition coming to your wrist throughout the day. So if you're typing and you find stuff feeling stiff, just stopping and doing 20 or 30 seconds of these lateral medial wrist motions can be, as helpful as a car, maybe more helpful because it's specific to the capsule of your wrist. All right, and relax. Go ahead and set that prop down for a moment, and we're going to come on to hands and knees and just get a little spinal awareness going. So for quadruped today, I'd like you to walk your knees out wider than your hips, wider than your shoulders. You can walk your feet out as well. And just take a moment here, make sure it feels safe on your kneecaps, but start to lightly pull the floor together with your knees, as if they were super glued to the ground and you're trying to pull the ground together. This might help light up a little activity in your inner thigh tissue. All right, and we're going to try to use that to get more idea of what's going on in the lower body and the lower back. Stiffen up your upper body, making your hands heavy, and then just kind of determine to not move anything above your belly button. So I'm indicating that roughly on Hannah's back. You guys are only going to move your lumbar spine. So start to curl your tailbone under, keeping those knees pulling together. And when you feel like you're going to start moving the area behind your belly button, just pause and start going the other way with your tailbone, reaching it towards the ceiling, feeling your spinal tissue shortening, and trying to lengthen through the front of your torso. Really reaching that area out, but before you feel your belly button start to get in on the action, curl it back under into flexion. You're on the clock here for 30 more seconds, going back and forth while trying to pull the floor together with your kneecap. Good. 15 more seconds. Can you make your hands any heavier into the ground? Let that feedback more effort and tension through your upper body. I like to imagine that we're turning up the signal of all of these muscle tissues in our brain. So our brain is getting the benefit of all of that information. 3, 2, 1. And relax. Nice. Okay, so come back to that seated position, grab onto your prop again, and we're going to work on some isometric training for your elbow joint in supination and pronation. So again, set up just like we did before, elbow into the body, and do that capsule rotation into pronation. So your palm facing towards the ground, and go all the way to a complete stop and try to check in on what would it take to rotate your forearm even a little bit more. Once you've proven to yourself that that really is your end range, then you're going to use your other hand as a passive support, and now relax and let your forearm fall into even more pronation. Now the elbow will rotate, but your wrist might also feel like it's rotating, and that is a-okay today. We're going to try to bias work going through that whole flow of tissue from your hand all the way up to your shoulder. So wrist and elbow stretch feeling is totally fair game. And you might feel a stretch here, or you might not, but the main thing is to feel, okay, I can't rotate into this position any further. From this end range, very lightly, I want you to start thinking about trying to lift that prop up into your supporting hand, but not letting any motion happen. As you do that, I'm hoping that you start to feel the contraction of a line of tissue or a line of tension that sort of wraps around your forearm. Ramp this up to 30% and hold it for 5, 4, 3, 2, 1. Now keep that effort, but rotate the opposite direction. So nothing moves again, but now you're trying to reach the prop away from your supporting hand and noticing some work going on the inner side of the elbow and definitely in the upper arm. 5, 4, 3, 2. Keep reaching away from that top hand. Take your passive support hand away, and now start to rotate the prop back now with motion, okay? And just go back and forth a couple times to visit that spot that we just had worked on isometrically. This is that really important step of getting your brain to assimilate the changes that we might have just made. Even if they were really micro changes, we want the brain to be on board at all times. Okay. Now go ahead and finish your capsule rotation into supination now. Palm up to the ceiling. And notice how this feels different, how this is now maybe stretching a different twist of tissue around your forearm. It might also feel like a different area is working to get you into this position. All right? And from here, we don't have good leverage to be able to stretch the elbow. So I'm going to ask you to just flip your soup spoon over while your palm stays up. And then use your prop or supporting hand to try to lift that soup spoon, and that will buy us more rotation in your elbow. Okay? Again, feeling some gapping or some stretching in your wrist joint is okay, so long as it feels safe and non-threatening. Noticing where you might feel stretch. And if you are one of us who has suffered from medial elbow tendonitis or epicondylitis, you might feel some stretching right in there, and that is can be very helpful. Okay, now from this position, we're going to start with our pales contraction again. That happens when you start to try to push the end of the soup spoon into your support hand, and that's the result of trying to rotate your forearm but not being able to because you have an immovable arm in the way. Ramp this up to a nice 30% contraction, nice and clear. 5, 4, 3, 2, 1. And then reverse the rotation. So you're trying to rotate your forearm into more supination, trying to lift the end of the handle off of your hand, but nothing is moving. 3, 2, 1, and relax. Good. Okay. Go ahead and flip the handle over and just do 2 or 3 capsule rotations on this elbow to seal the deal. Noticing how your brain now has access to some more tissue, or at least more direct access to the tissue that you felt earlier, and able to turn a little bit further. All right, let's get the same work in on the other side. So you're going to start by just remembering that rotation, supination, pronation, back and forth, and then go ahead and settle into a pronated position, palm toward the floor, making sure to not exaggerate that movement by letting the elbow fly away from your ribs, but just moving the elbow joint. Nice acting out, Hannah.
Thank you.
Oh, that's great. Okay, and then use your other hand. Start to push that forearm into now a passive stretch.
Side's different than the other side.
Yeah, you might feel more stretch. You might feel less stretch feedback. You might feel more in the wrist and less in the elbow. All of these variables are fair game, pretty normal. And because of all those variables, that's why we take the variable of movement away at first. That's why we're doing isometric training at first, because we really want to clarify the work where we want it. All right? So settled into this stretched end range position, lightly at first begin trying to rotate your forearm to think of lifting the end of the prop into your support hand. Really think of this as a rotational effort, and go ahead and ramp it up to a 30% pales contraction. 5, 4, 3, keep your grip strong, and now reverse the rotation. Think about adding more pronation to your elbow as if you were going to reach your object away from your hand, or maybe it will reach away from the hand. That is okay too. 3, 2, 1. Nice tight grip. Take your other hand away and begin rotating out of that position, and do a couple of those rotations. Now, one extra benefit that's happening here is, like, we are going to improve the specific position that you're working on, but by training the tissue, the long tissue here, it actually helps prepare that tissue to pull you into the other position. So doing both sides of the pails rails movement in both pronation and supination can help both. Okay? So go ahead, settle now into supination with your palm up. Switch that spoon over so you have better leverage, and then begin finding your passive end range by trying to lift the end of the prop. And here your ribs are in the way of your elbow, so your elbow can't really exaggerate. So you can actually use that to leverage out a little bit more, stretch. Good. If you don't feel a stretch, then that pails contraction should help you feel that long tissue when we start that up. So go ahead, light pails contraction to start. Thinking of rotating your palm back into pronation. The result of that is that the end of the prop pushes into your support hand, and this is our pails contraction. Ramp it up to 30% and hold that effort. 4, 3, 2, keep gripping strongly, and now reverse the rotation, thinking of trying to lift the soup spoon away from your hand. Might move, might not, but really focus on the contraction happening in that arm. 3, 2, 1, relax for a moment. Go ahead, keep this angle best you can in your arm, but just switch the soup spoon over. And again, finish with capsule rotation here. Good. Very nice. Just a few reps to make sure your brain is on board and trusts these positions. Because if it doesn't, you won't make use of them, and the structure won't really change. The use pattern won't change. Great. Okay, go ahead and relax that, let that go. And now we're going to set the prop aside. We will come back for a second round, but come down now into a half frog position on the floor. Okay. Great. So this position is going to be the result of bringing your either side leg out to the side into about a 90-degree angle. Kind of go ahead and bring this leg up just a little bit higher. Good. And hunt here at first to find a stretch in your inner thigh tissue on that leg that's out to the side. Okay? You might feel that by gently trying to turn your body kind of away from that knee, kind of walking yourself into this end range position. And for this first round, we're not looking for any movement, so we really do want to find your end range stretch if possible. Yeah, as you settle in. You really want to think about how can you open your inseam on that opening side more to the floor. Okay, turning your belt buckle more towards the floor. All right, once you're in your most stretched position, you're going to go ahead and begin thinking about making your knee on that side light. So you can leave your foot on the floor, leave that as a brace, but start thinking about what it would take for me to be able to swipe a piece of newspaper underneath that leg that's out to the side. As you think that more and more, you're going to get a bit more contraction going through that whole side of your hip, and I want you to just use this hold to explore that sensation as it turns on. Okay, go ahead, relax, let that knee come back down into the floor. This time, before you start trying to lift your knee, try to make your elbow on that side heavy. If that doesn't feel good, you could also just move your arm and push your hand into the floor instead. Can you show me that? Just push the, yes, just like this. So you have some real strong pressure here. Okay, now once you have that and you're bracing your midsection, again, try to lift that knee just enough to slide a piece of newspaper under there, and again, explore the contraction of that whole flow of tissue down the side of your hip. 5, 4,
3, 2, melt it down. Good. Okay, last one. Brace your torso again as if you're in a plank, really strong plank. Ramp up the pressure of that arm on that side. Try to put a hole through the floor under your palm. And then use all of that brace to try to lift your knee one last time. See if you can use that knee lift to try to stretch your inner thigh more. 5, 4, 3, 2, 1, and relax. Very nice. Okay, go ahead, switch sides. I'm going to have Hannah turn around, but you can stay in place. Good. Okay, check in that your knee is at a 90-degree angle. Just close it up a little bit. Bring that knee all the way up out to the side, and then open up your inner thigh towards the floor. So you're trying to find a stretch of your inner thigh. See if you can't turn your belt buckle more towards the floor and settle into this position. Okay. Now for round 1, brace your torso. Start sending the signal to that outer knee to try to get light on the floor, and notice what contraction happens. Anywhere from your knee through the hip all the way to the armpit is fair game here. So just sending that signal for this first medium effort. Good. 5 more seconds. Trying to really get your brain to lock into this position and what we're asking you to do. Relax. Good. Okay, make sure you're still stretching your inner thigh. This time, focus on bracing specifically the elbow or arm on that side that's working. So really brace there first, solidify your core brace, and then use that brace as a stable base from which you're going to try to lift your knee from the floor. Really sending a more clear signal, a stronger signal, and therefore maybe getting that knee to hover off the ground, or maybe not. 5, 4, 3, 2, 1. And relax. See if you can't open up your inner thigh anymore, turning your pelvis to face the ground, making sure you're still at end range. And final rep on this side, pushing your palm into the floor, heavy, heavy, heavy. Feel that spill over to your brace in your midsection. And now all systems go. Try to lift your knee off of the ground. So I could slide a piece of newsprint under there. 4, 3, 2, 1, and relax. Excellent. Okay, go ahead and come back to your seated position, and we're going to go back for one more round of our elbow rotation work. And we're going to use those isometrics, but not quite as fixed as we did the first round. Okay, so this is just going to help us improve our capsule rotation. So start again turning your palm into pronation, palm towards the floor. Use your other hand to try to bias a little further. When you can't go any further, 5 seconds. Try to lift the end of the soup spoon into your hand. 3, 2, 1. Now try to reach the end of the soup spoon away from your hand. Take your supporting arm away so that you know you're holding it in space. And now start rotating out to supinate your forearm. Find that end range contraction. Go ahead and flip your soup spoon over. Keep winding out more rotation. When you found end range, begin pushing the end of the soup spoon into your hand. Pales contracting for supination. 3, 2, 1. Now rails contract. Try to lift that end off the hand. Take your hand away. Good. 2, 1. Go ahead, use that hand to flip the spoon back over. Oh, that way. And then capsule rotate back. And we're just going to do a follow-up round here. So use that hand to emphasize more rotation. So we're just getting reps in here now. Find that end range. Once you find it, start to pales contract, trying to lift the end of the spoon up into your hand. 2, 1. Reverse the rotation for a rails contraction, trying to maybe cramp the inside of your elbow and some stuff in your bicep. Take your support hand away and begin to rotate that elbow capsule back, finding maximum amount of supination. switching the spoon handle and biasing a bit more passively. Good. Once you feel like, okay, that is as far as I can go, pails contract. Try to push the end of the spoon into your hand. And now try to rails contract, trying to lift the end of the spoon away from your hand. Cramping if possible in here. 3, 2, 1, and relax. Go ahead and switch that spoon to the other side, and we're going to get our mini set in here. Start with a capsule rotation for pronation. Find that end range and emphasize that range by using your free hand. Once you've found your end range position, begin pails contracting, trying to lift the handle up into your other hand. Okay. And now rails contract. Try to reach the end of that spoon away from your hand. Take your support hand away. And now when you reverse the rotation again, the soup spoon's actually going to move. Really finding as much active rotation as you can the other way. Remember that tissue might be more prepared now. Switch the spoon handle over while your palm stays supinated and emphasize further supination. Good. Once you find that position, pails contract. End of the spoon handle gets heavy into your hand as you are trying to rotate your palm back into pronation. 3, 2, 1, and reverse the rotation. Lift the end of the soup spoon off the hand. Good. 3, 2, 1. Switch the spoon handle over and back to pronation. We're almost there, team. Good. Emphasize further by using your free arm. Good. And begin your pails contraction, ramping up to 50% or more effort this round. 3, 2, 1. Reverse the rotation, trying to reach the end of the soup spoon handle away from your hand. I'm telling you, this is finicky.
Got lost there for a second.
Yeah. Make sure this hand's free so that you can begin to rotate away now. Okay, find that end range. Once you've found it, flip the spoon handle over, emphasize more. Begin to pails contract, pushing the end of the soup spoon handle into your hand. And now reverse the rotation, lifting the soup spoon handle away from that support hand. Good. 3, 2, 1. Flip that soup spoon handle over. We're almost there. And now just finish with a little easy capsule rotation back and forth. Good stuff. Okay, so that's how you would go about getting reps in to make sure you get enough training for that tissue to actually change and improve. All right, so now we're going to move back for a second round of our half frog work for hip abduction. So get back into that half frog position. This time, start with your supporting arm already out to the side because we're going to take advantage of that setup. So as you felt on that first round, either you weren't lifting the knee off the ground at all or you were lifting it just a tiny bit, and that indicates that you're not quite able to create movement in this range of motion. So we likely are going to have to give some range back. So to do that, instead of turning your belt buckle towards the floor, you're going to try to turn your belt buckle just a little bit towards that knee and then hold that, brace this position, feel your abs contract, feel some brace through that supporting arm, and then begin pushing harder and harder with that support arm as you start to make that knee light and look for the lift. Yeah, it might take a few reps and then go ahead, set it down. Okay, so once you find a spot where you're sure you can get a lift off, you're going to kind of resettle, notice the amount of turn required for your setup, and then brace. We're going to do 3 5-second holds, and this should feel like near maximum effort. You'll see Hannah shake it just a little bit. Okay, so brace, create that pressure, and use the push down to think lift up with your knee. Hold any height you've found. 3, 2, 1. Try to control the set down. Brace again. Press with your hand. Lift your knee. 5, 4, 3, 2, 1, set it down. Now on this last rep, when your knee comes up, I want you to also imagine that I ask you to lift your foot off the ground. You don't need to lift it, but that might get a little bit more involvement from even more tissue. So brace, push your hand into the floor, lift that knee, and think light ankle if possible. 4, 3, 2, 1, and relax. Okay, go ahead, switch sides. Hannah's going to turn around. Now the amazing part is that that is a position that we hit every time we do a hip car, especially when we're in a quadruped position for hip car. This is a shape that you make with your body, but by using the floor and turning in that way where we're finding our end of our active range, we get to really work hard at that last little bit of range of motion. So here, turn, do a little lift of your knee to make sure that it is a possibility. If you're not able to lift your knee, then you're going to turn more towards that knee. If you are able to lift it like a few inches, then you'd want to turn towards the floor a little bit more, and then that's where we're going to work for our holds. So brace, push that palm heavy into the floor, use that to start lifting your knee, and hold it there. 4, 3, 2, 1, set it down, good. And like Hannah's moving here, if you were able to get more than an inch, turn your belt buckle a little more towards the floor, brace, palm gets heavy, and then lift your knee, hold it, 3, 2, 1, good. And final rep here, brace strong, get your whole body involved, and then begin lifting that knee. Once it's off the floor, also think about lifting your ankle. 3, 2, keep the effort going, 1, and set it down with control. Excellent, okay? So now we're gonna seal that work back in by doing some hip cars. So come into a quadruped position. If this doesn't work well for you, you could come down to forearms and do a forearm quadruped. You could also do side lying if that's a better setup for you. But the main thing is that we want to try to feel for that spot we just worked. So let's go ahead and do 1 rep, and then I'll show you where we'll be doing some pauses. So start driving your heel behind you as you keep your body braced. Keep that heel lift, push your shin out to the side, rotate your thigh, bringing that knee all the way forward without letting your spine change shape. Pause when knees come together. Start going the other direction, knee to chest, knee out to the side, and pause here. So this should feel familiar to that half frog position that we just were working. Now keep moving smoothly from that range. Begin reaching your heel behind you, and smoothly bring your knee to touch your other knee. Okay, just 1 more rep. This time, optional add-on for this second rep is to take your opposite arm away. So now we're putting just a little bit more demand on your core brace, and we're going to do 1 more hip car rep there and back. Drive your heel behind you. Start pushing your shin out to the side. As that inseam faces the floor, notice that position, but smoothly move through it. Bring your knee all the way in front of your belly button and brush knee to knee. Reverse course, really leaning heavy onto the posted arm so that you're not letting the unsupported arm drop as you find that highest position out to the side. Very nice. Good. I hope you're working as hard as Hannah is working here, because that should be some high intensity work there. Okay, go ahead, turn it around to the other side. Find your brace. First rep, let's keep both arms on the ground. Drive your heel behind you, making sure to not let your spine change shape as your shin moves out to the side. Feel your thighs start to rotate. Bring that knee up towards your chest and across to the other knee. Keep breathing around your braced abs. Get ready for a pause here as your knee comes out to the side, and hold this half frog type shape, recognizing the work we were just doing, and now continue on your way through that position. Reaching your heel high behind you and bringing that knee all the way across to your other knee. Okay, second rep, turn up your brace a little bit. If you'd like to take your opposite arm away and put all of your brace and effort into that posted arm, That might help increase the intensity as we do our second rep. Heel to the ceiling behind you. Keep that height as you press your shin out to the side. Feel that rotation begin and get you into the half frog type position. Knee comes up to armpit, across, and touches your other knee. Make your way back, and then we are done. Great work. Moving smooth, even as fatigue is setting in, not letting the motion speed up. Excellent. All right, great work. Great work to you. And file that elbow work away if that felt useful for you, as well as that half frog position. Sometimes that can be really supportive for the sides of your hips. And have a great rest of your week.